Hello, everyone. I'm Joe Whitlock. I am with EFI Global. I am a senior industrial hygienist working out of the Great Lakes region. I have over 25 years of experience with heavy manufacturing, retail, food industry, higher ed, and laboratories. We provide industrial hygiene, environmental health, and safety services to organizations throughout North America.
Hello, I'm Michael Lorms. I'm a senior loss control manager for Sedgwick. I oversee specific loss control in our self-insured group, captive, and larger corporate account business. Today, we're going to discuss with you some of the return to work considerations around COVID, both from our backgrounds and our perspective. We're primarily going to focus on 4 areas: the communication, specific environmental changes, employee practice changes, and what the vaccine means for return to work. We'll also go over some lessons we've learned for the future and leave you with those final thoughts for today. So the first thing that came up with us when we were putting this material together, and that we've seen for over the past year, is how communication really plays into health and safety, and specifically risk management. So Joe, what are some of the things that you've seen, both be it good and bad communications around COVID, and what were some of the factors that through an implementation process were able to be beneficial, both from a cultural standpoint, from a health and safety culture, and then from the standpoint of being preventative to any further communication of the COVID virus?
Yeah, thanks, Michael. From day one, getting through this together, communication, how do you communicate to your employees is very essential. We've seen organizations that would give you a mask and set up a hand sanitizer station, and that was the extent of COVID-19 training. We've also seen organizations that would have daily communication with the workers, ask about screening, how family members were. So again, early on, the successful organizations really over communicated, but they also were reminded that essential workers, they came to work while the rest of us were working remotely, trying to figure out what to do. So, even in scarce and conflicting and complex information, organizations should focus on what they do know and over communicate what those minimum standards of performance are across their organization. We also saw success with organizations that had a central voice, maybe an ombudsman or other source, be it HR, EH&S, or the safety organization, where workers can go with their questions or concerns even after information was disseminated. We at EFI Global have always stressed safety at work and safety at home, and I think this is important. COVID-19, the things that you're learning at work to deal with customers and coworkers also applies at home. So the very same information received at work, workers could use that at home, and they can implement for their own children, elderly, or other at-risk family members.
So I've seen some good communication pieces used in conjunction with environmental changes. And what I mean by that are some of those advanced warning signage that you get when you're going to a retail location, some travel patterns that they've changed in the retail location, just doing a better job of giving visual cues prior to the individual encountering something, and not necessarily having it all be language, simply an X on the ground. People don't need any set of instructions to go stand on that X on the ground. So can we do the same thing in your mind for the workplace? Kind of like what IKEA has been doing for years and forcing us to walk through their store and see everything and then filling us up with Swedish meatballs on the end. Can we do that same thing in the regular office environment? And how would that interact with some of the environmental factors that we've kind of seen and been putting in practice?
Yeah, that's a great observation. I've also seen it compared to, we've created, airport layouts where everything's well telegraphed and well communicated. But the IKEA example and the floor plan, rethinking that for high density areas and traffic flow, I think that's going to be with us. That's important for spacing. The environmental changes, you can implement barriers, but also the just how you get in and out of an area is really important. Where there's forward-facing customers, what controls do you put into place? For EFI Global, we always have stressed local ventilation. What are you doing locally where your employees are at, the high-density areas where they must interface with customers and clients? So we've all heard the MERV 13 filters, get as high as possible filter rating as you can, but a lot of systems were not designed to have that pressure differential in the system. So we've seen other alternatives. We've seen tackified filters, we've seen electrostatic type filters to put in, but really at the end of the day, that local ventilation barriers and walkways that you talked about, a good old-fashioned HEPA portable filter works really well, and employees can control it based on where they're going for that day or that shift or the number of employees are in there. Again, that's 99.97% efficiency for filtering out the virus. So, you know, that is going to be with us, I think, as we return to work, and hopefully long term, you know, basic methods to reduce the COVID-19 concern are also going to work into the, you know, later on we see it in our cold and flu symptoms and number of cases we've had this year. So those are all good practices that we've seen firsthand.
So I know that in some other presentations that we've given, you've shown images of the inexpensive air filtration systems that are local ventilation or personal ventilation. Do I have to go out and buy some $5,000 local personal ventilation machine, or will something that's reasonably off the shelf from my local home goods store be good enough?
Yeah, just make sure it's stamped with the HEPA rating, and again, that's 99.97% efficiency. And obviously, pricing has gone up on those units considerably from you know, a year ago, but that's supply and demand. But you can get really good HEPA units, portable units, in your retail outlets, in your department stores, in your other stores out there. You can get them online, so they are widely available.
And that's one of those things where, you know, we talk about what we've done as far as communication, seeing something like that put into practice and then communicating to the employees the effectiveness of something like that, coupled with some of the other measures we're going to talk about, is a real compounding factor that gives them peace of mind and feels like the company is really entrusting them. But there's a safety component to it as well. And it might not be a upfront and personal safety component, but those machines are designed for certain air turns in a room. They're designed for a certain capacity, and they're designed to protect to a specific level. So when we couple some of those engineering practices with some other practices, what we call environmental controls, or even the administrative controls for how the employees are to act in a given set of circumstances, we're increasing that protective capacity, don't you believe?
Yeah, absolutely. The American Industrial Hygiene Association had a really good visual for that early on in their guidance documents. And it shows with just face coverings, you're going to get a 20% reduction, relative risk reduction by wearing that. If you actually look at the ventilation changes and improvements you can make, you can get 90, 95%, you know, relative risk reduction. And those are pretty high risk reductions. Not even talking about sanitizing and disinfecting the surfaces, but focusing on those engineering controls is the best way to protect your workforce and your customers and clients at your location. The air inhalation of the SARS-CoV-2 virus is the #1 way of a transmission. We now know that way after the fact. So anything you can do for relative risk reduction for the airborne part of the SARS transmission is what you need to focus on.
So speaking of some of those factors you just mentioned, what are some administrative controls that you're seeing put into place? Are you seeing anything specifically? We're starting to see folks getting plans together to return to the office. So with a return to the office or a return to the work scenario, we've seen phased roll-ins. We've also seen staggered roll-ins. We've seen essential personnel come back for a period of time. We've seen some of these other factors. So when you start to see those compound one upon the next, what are some of the things that you've seen that are good? And then what are some of the things that you have seen that you think might be improved upon?
Well, again, it covers the organization's response. It covers the entire spectrum. So we've seen come on back, little communication other than welcome back. We've also seen return to work programs where they've talked about continuing to do screening and quarantining if you have someone sick at home, and looking at the temperature checks, the contact tracing Organizations want to continue to do that. It goes back with the herd immunity. It goes back with the increased vaccinations that we're seeing. So you don't want to have a real spike in those positive cases, and fatalities, unfortunately, can still be prevalent if we're transmitting the SARS-CoV-2. So think about closely how you return your workforce, and can you do them can you return those employees in phases? Can you still effectively socially distance? Doesn't mean that you're going to hang out in the break area, in the lunch area, and talk about things you haven't been able to talk to your coworkers for the past year. So be diligent in monitoring that. Still have an effective plan for how to protect your most essential element of any business, and that's your employees. So again, even if employees are anxious to come back, make sure you're protecting them with adequate face coverings. Make sure you have the hand sanitizing stations, the social distancing, barricades if need be. Also, again, the HEPA filtration units we just talked about. There's a lot of locations that will still have to deal with customers and clients, and maybe as the states loosen the mask mandates, they're still going to have to deal with the public that may not be wearing their masks. So think about how you're going to protect your workers when they get back to the workforce. And again, they're your highest priority. That's the most important element of any organization.
Well, you touched on a lot of good aspects. Two things that you touched on that I want to address was some of the aspects around changing the way that we're doing business. And do you think it's essential that we draft policies and procedures around that? So do you think that it's essential that every organization adopt an infectious disease protocol as a lesson learned now that they can utilize going forward? And then I'll hold my second question until we hear from you on that.
Absolutely is the answer. So, I think organizations might have a short memory. There was just years ago, it was SARS-CoV-1. There was H1N1, equine, bovine. There will be another biological event. There will be another one in the US. We just don't know how soon and how severe. So organizations, make sure that they have a good plan and they're ready for the next event. OSHA, the Emergency Action Plan, that's a requirement. Not a lot of organizations thought about this or were prepared for it. There were some organizations that did think this through and had to respond, but definitely have that part of your program documented because there will be another event. Absolutely.
So we've kind of gone through it in essence. We went through the hierarchy of control. We've gone through some of the elimination, substitution, engineering aspects. We didn't go through the top two, but we focused on engineering. We focused on administrative controls. And now for the most polarizing question we always got, and you touched on it first. So personal protective equipment and face coverings. What are your scientific thoughts with regard to that? Because I know from your past experience, you have a good bit of information. So what do you believe from a purely scientific standpoint is the benefit of an N95 respirator and then some of the other variants that are out there? Should we require our employees to wear them when they return to an office setting? And what does that look like for us long term?
Well, there are a lot of questions in that question, so I'll take as I remember them here. So yes, you must have a face covering policy. To what extent N95s are really efficient at removing even the SARS-CoV-2 virus. They just have better face fitting features and they have a greater reduction. Again, the American Industrial Hygiene Association shows that the difference between just having face coverings, 20% relative risk reduction versus a 90% relative risk reduction just from wearing N95s. We know through testing and research that the capture efficiency really can't be matched by a face covering, bandana, the different types of devices we've seen worn out there in the public. So N95s really are a better example of what to wear for protection. And also EFI, since the beginning of the SARS-CoV-2 event, we've actually asked organizations to look at at-risk employees. Those who you're mandating to come to work could be at risk. So go ahead and put an N95 on them as well, because they're actually risking their own health and livelihood during a SARS-CoV-2 event. Maybe they have elderly or at risk at their own home now that the pandemic hit, and children and elderly might be in that same residence. So think about two at-risk parts of the population. But we know that face coverings are essential for also reducing your relative risk, for contracting COVID-19. So have a policy in place, but there is a spectrum of what is a better face covering, and the N95s are the top of that selection chart. So yes, N95s should be worn. I know that the supply chain, we talked about the disruption, we talked about getting back to normal for production. That's a higher level question on what we're going to do with our supply now that the N95 has been deemed essential for preventing spread of disease. So I know there'll be some future policy positions taken on that, but organizations, you can order those. They do have a shelf life, remember that. But as some of the research has pointed out, that they're still effective during times of, such as the COVID-19 pandemic.
Well, I definitely appreciate your insights when I speak to you about it. I'm sure everyone else did. I know that it's been a year, and over this year, we've had a lot of things that we've learned individually. And I know on other panels that you and I spoke on that you had one client in particular that made a capital investment, and that investment paid off this year in the cold and flu season. So we'll leave the folks with that one final thought to see how something that was a real proactive in nature actually did pay off for a specific client. Would you mind sharing that?
Yeah, absolutely. There was a particular example that we are aware of where a family-owned dental offices, they have 3 generations of practicing dentists, and they actually implemented controls, engineering controls. So they looked at UV to the air that's recirculating. It has a 99.99% inactivation. They looked at ionizers. They looked at engineering controls forward facing for those who are in their lobby. They're looking at extra cleaning on the weekend, and they looked at rescheduling at-risk clients. And so they had elderly and at risk, and they said, hey, why don't you guys come on a Monday and Tuesday, and we'll schedule the at-risk. That's when we know that our engineering controls are at the best operating part. And so, nearly a year later, getting through the cold and flu season, what they actually saw is they had just an enormous decrease in absenteeism. Their dental hygienists and their front-facing staff members, it was notorious to be out on just so many sick days during the cold and flu. That was part of the accepted business practice, is that you're dealing with customers and they're in the dental chair and you're going to be sick. And so, the return on investment is that initially they were looking at a decrease in patients that could even visit the dental office. Instead, by offering these controls and these extra administrative changes, they saw an increase in business where other dental practices did not prescribe the same controls. So they preserved their client base, actually increased it, and then they saw a decrease in absenteeism just from the cold and flu season. So long term, if you look at what this, and they don't have a huge profit margin for these offices, they're family owned. They thought the return on investment was going to be worth it, and it has paid off thus far. So long term, I think lessons learned from this example are there things that organizations can implement that'll make some improvements long term? And the answer is yes in this particular case for this dental office.
I think that's a great example of how people can approach this from a standpoint that can benefit them down the road. And so, as all of our audience focuses on returning themselves and their employees back to work. We urge you just to take a high level approach and work it down to the lowest level. Consider some policies and procedures. Consider advanced communication in conjunction with all of the other things you're putting into place, and just let your employees know that you care for them. We really appreciate your time today, and feel free to reach out to us with any questions. I've been Mike Lorms, and this is Joe Whitlock. We thank you.